Hi there. My name is Madison, the co-host and co-founder of The Room podcast. As the world around us continues to change and things continue to move only more rapidly than ever, it's important that we continue to open the door in new ways. I'm super excited for this segment and expect a few of them over the weeks that complement a lot of the themes that we're discussing on our longer form Core The Room podcast stories. Today, we're kicking it off with the Squad Health founder, and I can't wait for you to hear more. Let's open the door. Manav, first of all, thank you so much for joining us in the room today.
Thank you so much for having me.
We're thrilled to have you. This is a real treat. We're in New York City live telling stories about the best founders that are building these days in AI. I'd like to start at the beginning, though, with your personal story. Where did you grow up and how has that shaped your view of the world?
Yeah, so I grew up in Philadelphia. Go Birds. Huge Eagles fan. Huge.
You love birds.
Yeah,
I'm from Seattle.
Okay. Good luck this weekend.
Thank you so much. Fingers are crossed.
Grew up in Philadelphia. One of three kids, son of two doctors who both worked the whole time I was growing up.
Wow.
Which I think, obviously it's a little self-serving because I'm building in healthcare, but it really did influence how I thought about the world. Like I saw two parents who would leave at 7:30 before I could go to school and they get home at like 8:30 after I had dinner.
Totally.
Like working in healthcare. Ultimately, it was a dichotomy. Like half of them loved what they did every day. They loved taking care of patients. They loved being around other doctors and other physicians and other care providers. They loved the science of being a doctor. And then half of them, I think, just found immense frustration in healthcare, like billing or scheduling or, space to treat patients or all the coordination they had to do. I just felt like there was always this push and pull between both of my parents. One was in private practice, running his own practice, one at a hospital. So across the spectrum, there's this push and pull between loving what they did at its core but hating everything that came with it.
Sure.
Occupational hazard, as you say. That really shaped me as a kid because one, it made me not want to be a doctor because I was like, my parents are not around as much and they seem to have this real tension around whether they actually love what they do or not. And so I didn't become a doctor. I went to Harvard. I studied stat and CS. I was like, I'm going to stay as far away from medicine as possible. I spent the last 6 years very successfully doing that at Google and Stripe where I didn't touch healthcare at all. But ultimately I got pulled back in because I do feel like growing up, I felt like if you could solve that second part of it, which was the frustration around everything you had to do around being a doctor,
right?
Being a doctor was the most noble and sort of positive cause you could take up in the world. And I wanted to be able to enable people to do that.
It doesn't come as a surprise to anyone who has interacted with healthcare that there's an opportunity for technology advancement.
Yeah.
And it's interesting to hear about this lens from being on the doctor side, right? We, of course, as a person know it as a patient, but there is opportunity across the stack in healthcare to be innovating. For those who are listening, tell us what Squad Health does. And if you could use an explanation that your 5-year-old nephew might understand.
Yeah, and that's not a joke. I have two 5-year-old nephews who are 1 week apart from both of my sisters.
Nephews.
Shout out to my nephews. They've never asked me what Squad Health does, but
Fair.
If they did, here's what I would say. I'd say there are millions of patients in this country at any given point that have chronic conditions that make them very sick. And in order to live a healthy, normal life, they need access to medications.
Yeah.
And these medications are very expensive. And due to the way the system works for those medications, it's incredibly hard, time-consuming to get those medications. So sometimes they can't get them at all. Sometimes they have to wait months while they're suffering from these chronic conditions. What our platform ultimately does is it increases the likelihood that that patient's going to get that medication and they're going to get it quickly so they can live a happy and healthy life. That's ultimately what Squad Health does.
Well, you've had such a breadth of knowledge around the healthcare ecosystem growing up in the family that you did. I'm sure you've had to target specific buyers and personas within the healthcare ecosystem. How have you thought about narrowing that scope and getting your early product to market?
Great question. So when we think about our specific area around specialty medications, everyone before us has focused on pharma companies directly, and they focused on pharmacies, or they focus on insurance companies. I think the thing that is missing fundamentally is the focus on patient and providers. And so there's two reasons we focus on them. One is because we think that their biggest opportunity to solve this problem sits at patients and providers and serving them. But more importantly, I think that's just fundamentally our ethos. As I said about our background, I come from a family of doctors. My sister, before we started this company, spent almost a year and a half consulting for provider groups. So her strong belief was that independent provider groups, independent specialty groups, the GI that everyone sees for 30 years, the dermatologist you've been going to for 25 years, the rheumatologist you've started seeing because you had arthritis late in life, those doctors are not well served. And so the healthcare experience of their patients is not optimal in a way that no one is attempting to solve. No one has the focus or the ability to solve that problem because you have to go to thousands and thousands of doctors' offices to solve that problem. So it's our ethos, which is that we want to work with providers and we want to work with patients. And we think it is the untapped opportunity in this market. And when I say untapped opportunity, I not only mean like from a business standpoint, but it's just like the problem, the bottlenecks. If you go to a large healthcare system, you go to Kaiser, you go to Mount Sinai, you may not feel like that you're getting the most efficient care because you're bouncing between departments. But at the end of the day, all the incentives are in line. The financial and the patient and everyone's incentives are aligned. When you go to an independent provider, you have the doctor, you have the insurance company. The incentives are not aligned. There's too much coordination to be done. So we feel like there was an opportunity there. So every day when we wake up and we think about what are we going to build today, how are we going to think about improving our product, how are we going to think about improving our offering, we think about what is going to make it easier for independent providers and their patients to navigate the healthcare system.
Okay.
And that's what we do every day.
How have you seen the conversation about AI happening inside the room with the healthcare providers that you're talking to today?
It's a great question. So I'll come at it from two angles. One as the builder of the product, and then two, as I talk to customers and they try and understand what is an agent actually doing? Like when you say you're using agents to complete tasks, what does that actually mean?
It's not just automation. Like what else is under the hood?
Exactly. I think they want to understand because they want to understand what are the things, and it's not coming from a place of skepticism. It's coming from a place of support. They're like, we actually want an agent or whatever you're going to call it as the technology provider to solve my problem. What can I do to make that more possible? Like they constantly ask about documentation, things like that. So I guess let's start as a builder. I think you've nailed something, which is the problem with agents are not the agents themselves or the harnesses. It's the data that they have access to. It's the actions that they can or cannot take and the context they have to take those actions. So when you think about a prescription, the life cycle of a prescription, there's 5 to 10, sometimes 15 different tasks that need to happen. And so if we think about our platform, ultimately, we are sort of modality agnostic, and we have to be by definition. The thing that is hard about building this product is we need to figure out what are the systems that we need to integrate with. Once we integrate with those systems in the right way, push and pull, then we have the ability to take an agent and to give it the ability to do not just tasks, but complete an outcome. And I think that's the language I would use to talk to any builder is your goal is to start by building agents that complete tasks really well, and then to build a system that allows an agent not just to complete individual tasks, but to achieve an outcome. So in our case, it's like each of those different steps I just described are a task. And one thing that we're constantly talking to our friends who are builders and sort of pushing the boundaries on what agents can do is how do you turn it from a agent that does individual silo tasks to an agent that completes an entire outcome end to end, where those tasks might be recursive, they might lean on each other, data from one task feeds into another, the outcome of one task requires doing a task entirely differently from before.
Yeah.
Those are the things that are hard, and that's where like you can't just out of the box build things today. But right now our product is primarily used and lived today by providers. So I'm going to start by talking about how we talk to providers. Providers being doctors, advanced practice providers, but also their staff, medical assistants, nurses, anyone who works in an independent clinic. When we started talking to them about the platform that is Squad Health, one of their biggest concerns was how are you going to access our data? Because we have integrations with cloud-based EMRs that use agents that log in like a human. And for most providers, they love that. They're like, I get built-in audit capabilities to what your agent is seeing. I can see a trail of every single document it's pulling. It feels really safe and secure from a HIPAA standpoint because your agent operates like one of my medical assistants. And I treat one of my medical assistants like a liability, not in a bad way, just everyone that has access to my patient's data is a liability to me as a practice. And so the fact that I can sort of treat Squad Health like a medical assistant is amazing because I can audit everything they're doing. I can turn off your access at any time. I'm not giving you back-end access to some database. And so they actually do want to get into the weeds of what your agent is doing, how it's interacting with their systems, because in our world in healthcare, it's really important to understand what can I audit and what does your agent have access to and what control do I have over what it has access to. But we came across this very large group that said, we are not okay with a bot living inside of our system. So we're going to ask you to integrate in a different way. We're going to ask you to integrate via API because we don't want you in theory to be able to go and access any data about a patient. These APIs are sort of restricting what you can get. And what you encounter is that being able to talk about your system, and our system luckily is flexible enough to do either integration, being able to talk about the underlying technology that you're using, but more importantly, the way that it works and use language that your customer understands, right? In our case, they understand how access works for their staff. They understand how audit capabilities and sort of revoking access and control works for their staff. And when you can very clearly draw an analogy to what your system is doing, they get very comfortable very quickly. And then they very quickly pick up on, oh, well, if your agent is sort of operating like my staff, one of the big problems that we run into is we constantly mislabel documentation. Like we have lab reports and they're not labeled as lab reports, or we have insurance cards, they're not labeled. And they quickly understand like an agent isn't God. It's not omniscient. if you don't label things properly or documentation isn't in the right place, an agent can only go so far, especially if you're operating under a principle of minimum, like data minimization, which is like, we don't want to read every single document, every single PDF, because that's dangerous.
Yeah.
And I think they very quickly pick up on, here are things that we can do as users of AI to make AI more efficient.
Absolutely. I think you're really doing an excellent job at articulating this dynamic that's happening with inside of companies, inside of stakeholders, where there is unknown unknowns, and then there are known unknowns, and how you help assuage some of those questions and concerns for a new world in which people's jobs can be done more efficiently is hard to do, especially when there is like doomsday headline articles about a lot of this, especially in healthcare. And I know, speaking from the Vercel standpoint, we used to only have HIPAA compliance and BAA on our enterprise contracts, but we recently were able to put that feature into our Pro, which is our much more flexible plan, because we really believe like this type of security is paramount to anyone who's building and shipping software today, and absolutely should be baked into the rails of the infrastructure, enabling the end user experiences.
100%. I think Vercel taking that step shows that you understand what it's like to build an early stage healthcare, because there's so many tools that early stage healthcare builders want to be able to use, and they don't support some of the just core BAA HIPAA functionality that you need as an early stage builder, like the ability to sign a BAA, to be able to do 0-day retention for PHI. And so the more that we want to be able to embed ourselves in software that we want to use to integrate them with our systems, the more you allow us to do that, the more, frankly, invested we're going to be in that ecosystem. And I see Vercel being at the forefront of it.
Incredible. Well, we appreciate that shout out. You've talked a lot about the actual product that you're building today, the market that you're building into. So let's leap into the future. End state of Squad Health. You're ripping, you're roaring. What does it look like? What does this future look like?
There's a medium end state, which is like if we hit a double or a triple, and then there's what happens if we hit a home run. I think if we hit a double or a triple, let's say, a patient who has Crohn's disease, which is a debilitating lifelong condition. I have lots of friends that have Crohn's disease that needs a medication like Skyrizi that costs $120,000 a year, has the same experience being prescribed Skyrizi that you and I do going to pick up a $10 cream from the pharmacy, which is I get it immediately from the right place at the most efficient cost without sort of like administrative delays. I can go to my doctor's office, they can prescribe me a medication, and within hours I can go get it from the pharmacy. That's the experience you and I have today, picking up a $10 ointment. That's not the experience a patient has with Skyrizi. Right now, they're only getting it 40% of the time, which is absurd. Like, imagine saying I could only get my cream 40% of the time.
And it's life-threatening.
And it's a life-threatening condition, and I have to wait a month to get it. Meanwhile, I'm suffering through a flare or something like that. So that's if we hit a double, is that it feels that easy as a patient and as a doctor. It's as easy to prescribe Skyrizi as it is the cream. I think long-term, what we want to do is actually just realign incentives around medication, because at the end of the day, insurance companies have a reason to put these barriers up, which is as medication costs are rising, as the availability of medications are rising, as there's more medications available, more patients are being treated, more patients are being diagnosed, costs are ballooning. And the problem today, from my standpoint, is not necessarily that they're just cracking down and saying, no one can have it. The problem is that there is no trust between who actually needs the medication and who's able to get it.
Sure.
You have to jump through all these hoops because doctors don't trust what insurance companies are telling them. Insurance companies don't trust doctors. I think at the end of the day, what we're doing is building real-time intelligence between those two systems. The doctor has unstructured data, which is the entire clinical history of a patient, and the insurance company has guidelines. There's no reason to have 11 phone calls and 5 faxes and 6 forms back and forth to figure out if the clinical history meets the guidelines. And that's, to me, if we hit a home run, is we've taken it from any coordination to a single point of coordination.
I'm excited for this future as a patient, and it will definitely have a serious impact in either alternate universe, but I'm rooting for the home run. Manav, thank you so much for taking the time with us today to sit down and tell the Squad Health story. It was such a pleasure.
Yeah, and thank you for having me and giving me the opportunity to share it.
Thank you so much for joining us at The Room Podcast. If you want more from The Room every week, subscribe to our newsletter at theroompodcast.com/newsletter. We'll be back next week with a new episode, an inspirational guest, Tuesday, 10 a.m. Eastern, 7 a.m. Pacific. See you in the room.